We're back on Born B464. This has been such an exciting show already. I think we could do this for hours and hours. And we have with us today Dr. Mark Mandell-Brown from the Mandell Plastic Surgery Center. And we also have Marty Schultes. And we had a question from Peggy, and she'd like to have the rest of the answer on the angel wings, I think you called them.
So one of the facets is that when you have surgery for your arms, definitely do both at the same time. The surgery takes about 2.5 hours, and it's done under local with maybe a little IV sedation or twilight anesthesia, just like if you were going to have colonoscopy surgery procedure or maybe a wisdom tooth removal. So it can be very light sedation. The recovery is about a week to 10 days for that.
And do you have to wear compression?
Yes.
Tell us what that looks like.
And so we order a special compression garment. And the compression garment covers the operative area. And the idea is that it's almost like a girdle or something that's tight that helps keep the swelling down. And you may wear that for about 4 to 6 weeks.
4 to 6 weeks you wear them every day?
Every day.
And you sleep with them too?
And in bed 24/7.
Right. But you can't take them off to, can you take them off to take a shower or something?
Yes, but we put special sensors in them. If you leave them off too long, I will call you on the phone.
You're going to beep.
Hello, where is that garment?
Where is that garment, right. I know Marty has a couple more questions, right?
I do.
Concerns?
I did. Well, you know, we were talking before, and I was just kind of wondering, we talk about trusting your doctor, and, you know, when I would go like, oh, I don't know where to start. I know something's wrong. I know I don't like this or I don't like that. But, you know, at what age would somebody consider a plastic surgery or fillers or Botox or things like that? And then how do you counsel somebody who comes in and is just kind of all over, like, I don't like this, well, maybe I don't like this, or this bothers me. So how do you handle that person, or how do we start the process?
Right, and so some people really want a roadmap. They want to have a roadmap. Now, I will say most of our patients, they've thought about it, they say, I want my arms reduced, or I want my nose bump reduced, or I want a chin implant, or I want breast augmentation. So they'll have something that they're focused. For others, we can at least enlighten them on what the Botox products do, what the filler products do, whether they need surgery or not. And I always say, even though you guys aren't doctors, we all took health in the 7th or 8th grade. So a lot of it is common sense. Now, if you ask me about my car, I'm probably in the same place. I don't know a carburetor from the ignition, so I'm really at the mercy of the mechanic. And people, the patients are at the mercy of the physician. But I think it should be a collaborative arrangement. So I'll turn it back to the patient and say, well, when you look in the mirror, what is it that, you know, concerns you or you're thinking about? And then the other thing is with technology, we have, and we showed Kathryn, computer imaging. And so we can take your picture, put it on the computer, and I can make some changes, and you can say, you know what, that's exactly what I was thinking, or, nah, you know, I think I'll hold off. So I think it's important that you don't feel that it's a pushy, that they're talking you into a lot of procedures. I think you have to look at the downtime, you have to look at the cost, and you have to look at whether some people like to dive into the deep end of the pool, and some people like to tiptoe in. I'm a tiptoer. I don't like to jump in that cold water. So, you know, it's plastic surgery is like that too.
Okay.
Do plastic surgeons have plastic surgery done on them?
Yes, they do. And some of them have had good work, and some of them have had not so good work. I have a friend who's very famous, and he had the worst hair transplants in the world.
Oh, no.
And so you can see the doll's hair plugs that just don't look good and natural at all. I myself had a friend of mine do my upper eyelids, where he removed some skin from my upper eyelids. My family said, well, you know, when you're on TV, Dad, you look like you're asleep because that skin is just hanging down. And so it's, I think, a very important point that a lot of the patients that I see, say for the protruding ears that stick out, or the nose bump, or something else, they've been teased in elementary school or by some older siblings, and they've carried that all through their life, and then at some point they say, I'm going to do something about it.
Right. It means something to you to have the self-confidence.
It's the self-confidence.
It's really self-confidence, and I know a lot of kids that are teenagers that have the ears that go out there, and it really bothers them, and they are teased terribly. So I know you had some questions about your daughters had some questions. What were they?
Well, I have 3 daughters, and my middle daughter is very, very busty. Very busty, and to the point where her back aches a little bit here and there. And my concern with her is at some point she probably does need to have a reduction done because she's not overly tall, and she almost looks uncomfortable, and her shoulders hunch a little bit. But as a matter, it's like, well, I don't want to say go have surgery to her, but on the other hand, I want to say, I want you to feel beautiful. I want you to feel confident. I don't want you to hide yourself. But at what age is an appropriate age? And how's the recovery on something of that nature for a young girl who's in her early 20s?
So she's about how old, would you say?
She is 20.
She is 20. So when you have somebody who's very busty, you try to find out if they are having back pain. Sometimes because of that extra breast tissue, they'll get rashes under their chest, itching and yeast infections. And so that is something that sometimes insurance will cover. And the magic number is 500 grams. If your breasts are fairly large and you can remove 500 grams per side, and I'd have to get my calculator out to see how many ounces that is. But 500 grams, then the insurance will cover it. Now, a friend of mine said, I sent him 500 grams. I said, no, it had to be 750 grams. So it just depends on your insurance. But sometimes that is covered by insurance because it's a health issue. The two critical aspects are maturity of the young adult, because you do have scars that are permanent, and we can't predict how they'll heal. Now, for that breast reduction, we call it a keyhole scar, where you have a lollipop type incision, an incision around the areola, straight down, and often an anchor incision. Now, part of that may not heal as well as when we do just a straight breast augmentation. So we need the maturity of the young individual to be able to cope with healing and incision scarring, things like that. But I would say at 18 or 20, that's not an unusual age. Some people say, I'm going to wait till I have babies and breastfeed or am pregnant. And some people do it earlier. So it really just depends. We call that hypermastia. So enlarged breast hypermastia. And in general, in plastic surgery, the have-nots want and the haves don't want.
That's true. And on that note, we need to take a short break again on Kathryn Raaker's Born Before 64 with Dr. Mark Mandell-Brown of the Mandell-Brown Plastic Surgery Center and Marty Schultes. We'll be right back.